Good afternoon. I am Dr. R. Lalita, Senior Consultant Neurophysician at Indus Hospitals, Visakhapatnam. Today, I would like to tell you briefly about GBS, that is Guillain-Barré Syndrome. This Guillain-Barré Syndrome is a disease which was identified during Second World War time. Many soldiers were dying of a kind of peculiar paralysis. They used to have paralysis starting in the legs, which was going up to involve the body, and they were dying. At that time, autopsies showed that there is a defect in the cells in the spinal cord. Whole body is full of nerves, top to bottom. These are called cranial nerves and spinal nerves. In the head, they start from the brain, and in the body, they start from the spinal cord. So when the roots are damaged, patients were not getting sufficient current from the brain and spinal cord, because of which there is a paralysis. This is of several types. In the ascending type, it starts in the feet and gradually ascends up to involve the upper limbs, the chest part, the respiratory muscles and the heart muscles, leading to respiratory paralysis. We have a descending variety. It starts from the head first and then goes down. Sometimes people will have only problem in the eyes and defect in the balance. Sometimes we have what is called a paraparetic variant, where only the legs are paralyzed. How do we treat them? This is of basically supportive treatment, paracetamol, antibiotics, and then the specific treatment is either IV immunoglobulins or plasmapheresis. We remove the blood and clean it and put it back into the patient's body. Both are slightly expensive procedures, but nowadays with modern medicine and supportive care, all the patients with Guillain-Barré syndrome, almost all of them are recovering. How we diagnose? Usually there is what is called an antecedent infection. There is a viral fever, or there is a urinary tract infection, or there is a diarrhea, usually Campylobacter jejuni outbreaks. They cause infection and inflammation in the peripheral nerves. Usually they start 2 to 3 weeks. Sometimes they may start early also. So if there is any antecedent infection followed by weakness of muscles, patient is unable to walk or unable to do anything with the hands and legs, we can consider Guillain-Barré syndrome. Thank you so much.